Because if I end up at Flinders again...
Jason and Mel Mount Stephen loved volunteering as ambulance officers.
I followed my brother into this ambo stuff. I absolutely love it.
So much so, the siblings starred in this ad campaign, encouraging people to join up.
Jason reckons he has to keep up with me, but I reckon it's the other way around.
But Jason had to quit volunteering after he was diagnosed with a heart condition in 2012. And in 2019, that illness turned into an emergency. The family says it took 20 minutes for the ambulance to reach Jason at Victor Harbour, south of Adelaide. He couldn't be saved.
There was some crews that were ramped. Other crews were just busy on jobs.
Health authorities at the time said they were satisfied with the response time, but the family doesn't feel the same way.
Whether he would be here today or not is just something that we can't allow our brains to play with.
Data from the AMA shows that no state or territory is meeting its ambulance response time targets, and that's in part due to a workload that continues to grow. The number of people attending emergency departments has increased by around 800,000 patients in the past 5 years. Ramping is when an ambulance is stuck outside of an ED, unable to offload patients into overcrowded hospitals.
So if you've got 10 or 12 ambulances lined up at the emergency department, that's 10 or 12 that can't respond.
Governments are under pressure to create more space in hospitals by adding extra beds and wards. But like a new car park, eventually those spots fill up, and before you know it, you're back to where you started.
The problem in the hospitals is what they call bed block, where there's a patient in a bed that doesn't need to be there.
Misha Tame was born with a rare neurodevelopmental disorder.
She has seizure activity, she has apnea where she stops breathing, and she also has dystonia and other physical ailments as well.
Not expected to live past 2, she will celebrate her 12th birthday in August.
You going to sing it with me? True.
Kathy describes her family as ED frequent flyers, often spending 2 to 3 days in hospital at a time.
The endless waiting there and having to explain yourself over and over again is very distressing. Somewhere over the rainbow.
Misha is much more comfortable being treated at home by her GP, but it's not easy to find one.
By having the services, you can save an ambulance trip.
This is a far greater problem because often that deterioration in their condition was entirely preventable if they'd been able to access their care they needed in the community when they needed it.
Doctors say there's many reasons for ramping beyond GP shortages.
In fact, you could say we don't have a health system. We have a series of disconnected health services. We need to pull these services together.
Those the days. Yeah. Those were the years.
4 months after Jason Mount Stephen's death, his sister Mel was diagnosed with the same heart condition. She hopes the country can work together to improve the health system the way her brother tried to as a volunteer.
He'd make the effort for anyone. He wanted the service to change. He knew it was starting to go down.
A problem without a quick fix. Ethan Ricks, ABC News.